Hello, I'm Erin Owak, aesthetic nurse practitioner for Ageless Medical in West Fort Lauderdale, and we are one of the few platinum providers of Botox in South Florida. I've been doing injectables like Botox and Dysport to patients in Florida since 2001. I'm a national trainer for Allergan, the manufacturer of Botox, training doctors and other medical practitioners in South Florida on how to effectively administer Botox. I'd like to share with you my experience and knowledge on how these injectables have helped our patients look younger during this short video. There are 3 neurotoxins available in the US: Botox, Dysport, and Xeomin. Today I'll be injecting Botox on one of our patients, Carla. Carla's had Botox and Dysport before, and she'll also be sharing her experiences. We're going to be injecting Botox into Carla's glabellar area, right in between the eyebrows. This is the most common area to have Botox and Dysport injected. Botox and Dysport work by blocking the nerve impulses to the muscle. These fine lines are formed by repeated movement in that specific area. So Carla, make that motion so they can show. That's the movement that causes the lines in the glabellar area. The forehead lines and the crow's feet are also areas that are typically treated. So the forehead and then the crow's feet. Perfect. Carla's had numbing cream on for 20 minutes prior to this procedure, but many of our patients choose not to have any numbing cream because it's really not very painful. What I do first is have the patient move that muscle so I know exactly where the proper placement to inject is. So Carla, move that muscle again. And I can see the muscle starting from about right here, down through this area, and over here, and that's called the corrugator muscle. So I first clean the area with a little bit of alcohol. And she's had a little bit of numbing cream on prior to this injection just to make it a little bit more comfortable. And then again, before I do the injection, I'll have her move that muscle so I can see exactly where her muscle contraction is, where the muscle is, and where I need to inject. So go ahead, Carla. Perfect. And then relax. So after the injection, you're left with little injection site bumps that will typically last about 15 to 20 minutes, and then you won't see them after that. Every area requires a certain amount of Botox, which is about 20 units an area. So Carla, tell us about your experience with Botox, and was it painful at all?
Oh, not at all. I've had Botox and Dysport before, and it's just very painless. It's very effective in all this area that you just did.
And it's also a very quick experience too. Mm-hmm. Carla, how long did it last for you?
Well, it takes a little bit to take effect, but it lasts about 3 to 4 months.
A very common concern with my patients is the safety profile of Botox. Botox has been out since 1989 with use in both therapeutic and clinical aspects. It has been in use since 2002 for cosmetic use. From my experience, there's very little difference between Botox and Dysport. However, some of our patients do prefer one over the other. It does take between 2 to 7 days before you see results. The effects of Botox can last up to 3 to 4 months. Carla, any last comments for a person that's never had Botox or Dysport?
Well, from my experience with Botox and Dysport, are very effective. I always end up with very smoothness, and like somebody took a little iron and took all the wrinkles out.
Thank you so much, Carla. So if you have any questions or you would like a free consultation on how Botox or Dysport can help you look years younger, please contact us at 954-680-8330 or at www.haveagelessskin.com.